Hello everyone, welcome to our presentation on mammography. This presentation contains the introduction about mammography device, its working principle and parts, the procedure, advantage and disadvantage of mammography device, and the limitations which is found in the device in future work of a mammography device. We will see all about these things in this presentation. Mammography is a specific type of breast imaging that uses low-dose X-ray to detect cancer early before woman experiences symptoms when it is most treatable. And it's also a specialized medical imaging device that uses a low-dose X-ray system to use inside the threads. Mammography exam is called mammogram, which aids in the early detection and diagnosis of breast disease in women. Firstly, it's invented by Berlin surgeon, whose name is Salmon in 1913. An X-ray radiography is an non-invasive medical test that helps a physician diagnose and treat medical conditions. Imaging with X-ray involves exposing a part of the body to a small dose of ionizing radiation to produce pictures of the inside of the body. X-rays are the oldest and most frequently used form of medical imaging. There are three recent advances in mammography include digital mammography, computer-aided detection, and breast tomosynthesis. Digital mammography is also called full-field digital mammography, is a mammography system in which the X-ray film is replaced by electronics that convert X-ray into mammographic pictures of the breast. These systems are similar to those found in digital camera, and their efficiency enables better pictures with a low radiation dose. These images of breast are transferred to a computer for review by radiologists and for long-term storage. The patient's experience during digital mammogram is similar to having a conventional film mammogram. The other system is a computer-aided detection system, which search digitalized mammographic image from abnormal areas of density, mass, or calcifications that may indicate the presence of cancer. The computer-aided detection system highlights these areas on the imaging, altering the radiologist to carefully assess this area. And the other breast tomosynthesis method, also three-dimensional mammography and digital breast tomosynthesis, is an advanced form of breast imaging where multiple images of the breast from different angles are captured and reconstructed into three-dimensional images. In this way, 3D breast imaging is similar to computer tomography imaging, in which a series of thin slices are assembled together to create 3D reconstruction of the body. When we come to this image, this mammography image, this X-ray tube filter collimator will transfer a light array to this compressed device grid film screen, or there is a detector here, and which detects the coming ray from the collimator and will be captured by the film screen and also sent to the physician through the wires to be displayed or seen by the physicians or the radiologists. This one is the working principle of mammography, receptor display contrast characteristics. There are receptors here which collect a signal from the breast, and these coming signals from the receptor are processed by digital imaging processing device, and the processed image will be displayed on the display to the physician or the radiologist, and it will be displayed by the film to the patient. These are the parts of mammography device. Uh, Here is the X-ray tube which generates the X-ray. Here is the tube port and filtration, and there are different filters here, and collimation device which collimates the coming filtered ray. Here is the compression panel which compresses the breast, and here is a grid, screen film, phototimer detector. These are all the parts of mammography device. Here is the working procedure of a mammography device when the person is in mammogram or the woman is in mammogram. The woman stands and puts her breasts on the plate, a breast firmly pressed via other plate. The flatten and keep it still for few seconds. Then the woman get to X-ray image for each breast, Then the plates are tilted to take a slide view of each breast. Follow same step for the other breast, since that is performed on the first breast. Then the result interpreted by radiologist. Radiologist analyze whether she has cancer or not. The woman aware her health condition. This is the procedure how to the women's be diagnosed by using a mammography. There are different advantages of a mammography device. Some of them are listed here. Uh, the imaging of the breast involves a physician's ability to detect small tumors. When cancers are small, the means has more treatment options. The use of screening mammography increases the detection of small abnormal tissue growths confined to the milk ducts in the breast, called ductal carcinoma. These early tumors cannot harm patients if they are removed at this stage, and mammography is an excellent way to detect these tumors. It is also useful for detecting all types of breast cancers, including invasive ductal and invasive lobular cancers. No radiations. Here is another advantage. No radiations remains in the patient's body after an X-ray examination. X-ray usually have no side effects in typical diagnostic range of this exam. There are disadvantages that occur on the mammography machine. Some of them are: there is always a slight chance of cancer from excessive exposure to radiation. However, the benefits of an accurate diagnosis for outweigh the risks. The effective radiation dose for this procedure varies, and we will get false positive mammograms. This is another disadvantage. 5% to 15% of screening mammograms require more testing, such as additional mammograms or ultrasound. Most of these tests turn out to be normal. If this is an abnormal finding, a follow-up or biopsy may have to be performed. Most of the biopsies confirm that no cancer was present. It is estimated that a woman who has yearly mammograms between age 40 and 49 has about 30% chance of having false positive mammogram at some point in that decade, and about 7% to 8% chance of having a breast biopsy within a 10-year period. A woman should always inform their physician. This is another disadvantage, or X-ray technologist, if there is any possibility that they are pregnant. These are the disadvantages of mammography device. There are limitations on the device. Uh, Initial mammographic images themselves are not usually enough to detect the existence of a benign or malignant disease with certainty. If a finding or spot seems suspicious, your radiologist may recommend further diagnostic studies. Interpretations of mammograms can be difficult because a normal breast looks different from each woman. Also, the appearance of an image may be compromised if there is powder or salve on breasts or if you have undergone breast surgery, because some breast cancers are hard to visualize. Radiologists may want to compare the image to views from previous examinations. It is very important to realize that not all breast cancers can be seen on mammography. At the future, 3D tomography will be added on already existing 2D mammography procedures and other breast imaging techniques to improve the accuracy on cancer cell identification. And thank you for your listening. Goodbye.